Hi, I'm Brooke Schufelt, and today I'm recording my chest and extremity assessment video. Before I begin, I'm going to have my recorder scan the room. Okay, prior to entering the patient's room, I read the chart, got as much information on my patient as possible before entering the room. When I enter, I'm going to either close the door behind me or pull curtains to provide my patient privacy. I'm going to wash my hands, and then I will introduce myself and find out who my patient is. So hi, I'm Brooke. I'm going to be your nurse today. Can I see your ID bracelet? And can you give me your name?
Matthew Fritz.
And your birthday?
March 7th, 2000.
Okay, so I'm verifying that his ID bracelet does match the information he has given me. So today we're going to be doing an assessment mostly on your chest. So we're going to listen to heart sounds and lung sounds, and then we're going to take a look at your extremities, both your arms and legs. Okay. Can you tell me your reason for being here today?
For a checkup?
Okay. And are you having any pain?
Nope.
Okay, perfect. So just observing my patient, his face is nice and relaxed. His breaths are nice and even. There's no signs of respiratory distress. He's not using accessory muscles to breathe, which is good. Looking at the overall skin, color is well distributed. It's appropriate for his ethnicity. I do not see any lesions or masses that pop right out at me. I'm going to feel skin. It is dry and warm to touch. I'm going to start with your neck. Have you ever had any neck injuries?
Nope.
Okay. Do you have any trouble with range of motion
Nope.
with your neck, moving it? Okay. Any trouble swallowing?
Nope.
Okay. I'm going to check for jugular vein distension. So I'm going to have you lay flat and observing the jugular veins on both sides. I don't note any distension, even though some would be normal. I'm going to go ahead and have you sit back up, and we're going to have you raised up at a 45-degree angle. Still, I don't know any jugular vein distension. If there were jugular vein distension, it should disappear as the patient sits up. That would be a normal finding. So, okay, go ahead and sit back up. We're going to move now to your carotid arteries. I'm going to palpate them one at a time. I'm going to focus more on the lower 1/3. Both carotid arteries were equal bilaterally. They are of normal rate and rhythm, and I'd rate them probably about a 2+. So now I'm going to listen to the carotid arteries using the bell of my stethoscope. I'm going to listen to 3 different places on each side. I'll have you take a deep breath and hold, okay? Go ahead, deep breath and hold. Very good. Go ahead. Take a nice breath. Give you a minute. Okay. One more deep breath. And hold. Okay, good. Go ahead and exhale. Carotid arteries both sound good. There's no bruise, and I did not feel any thrills or vibrations. Okay, we're going to move down to the chest and start with the heart. Any history of heart disease?
Nope.
Any chest pain?
Nope.
Okay, any family history of cardiac issues?
Nope.
Okay, do you have any shortness of breath?
Nope.
Any shortness of breath with exercise?
Nope.
Okay, do you exercise on a regular basis?
Yep.
Okay. So we're going to listen to 5 different areas of the the heart, we're going to begin on the right sternal board at the second intercostal, and we're going to listen for the aortic sounds. We'll move over to the left sternal border, second intercostal for the pulmonic. We'll move down to the third intercostal, left sternal border for Erb's point, which is about the middle of the heart. And then we're going to move down to the fifth intercostal border or space, and left sternal border for the tricuspid. And then we'll move over, same fifth intercostal space, but mid-clavicular line for the mitral valve. So I'm going to listen again with the bell of my stethoscope. Just go ahead and breathe normal. So we're going to find the sternal notch in the second intercostal space. And that's aortic. That's pulmonic. Erb's point. That's tricuspid. And mitral. All heart sounds were normal. S1 and S2 were noted. No extra sounds or murmurs, rubs. All normal findings with the heart. Also, when I was listening to the mitral down at the fifth intercostal mid-clavicular line, where the apex is at its maximum impulse, I did not know any heaves or lifts at that location, so that is a normal finding. We're gonna, I'm going to go over the skin of the chest. I think I noted earlier, but there's no lesions or masses. Skin is warm and dry. I don't see anything abnormal. Palpating, I don't feel any crepitus over the lung fields. And we establish history of cardiac. So we'll move on to the lungs. I'm going to map out the lungs by finding the clavicle bone. The apex of the lung starts just above that on each side. We're going to do side to side all the way down to about the fifth rib. I'm going to percuss first in all of those places. Okay, all sounds were resonant, which is a normal finding. I'm now going to listen with the diaphragm of my stethoscope to each of those places that I percussed. Just take a deep breath in and out each time I move my stethoscope, okay? Go ahead. And out. Deep breath. And out. Again. Very good. All lung fields were clear. There weren't any adventitious sounds such as wheezing or crackles or rhonchi in any of the lung fields. So that completes our anterior chest. Now I'll have you swing your legs around and we're going to take a look at the posterior chest. Okay. The skin, I'll go ahead and feel, is nice and warm and dry throughout. Color is evenly distributed and still appropriate for ethnicity and matches the anterior of the body. I'm going to palpate the chest wall. Any tenderness at all?
Nope.
No crepitus felt on the posterior chest of the wall of the chest. I'm now going to measure AP diameter. I'm going to measure the sides. AP diameter is normal. It is a 1-to-2 ratio. We're now going to check for symmetrical expansion. I'm going to squeeze my fingers and go ahead and take a big deep breath. Okay. Symmetrical expansion was normal. Both sides rose equally and symmetrical. Do you have any history of lung issues at all?
Nope.
How about family history of lung problems?
Nope.
Okay. Any shortness of breath?
Nope.
Okay. Any recent colds?
Nope.
Okay, good. I'm going to map out the lung fields of the posterior chest. We'll find C7, which is the bottom of the neck, the bony process, which will map out the apex of the lungs on the posterior. T7, which is about the bottom of the scapula, that's about T7. If you take that about 3 down, that's about T10 in the bottom of our fields. So we will wrap that around and go up to the axial line for T6 and T8. So I'm going to actually percuss each of those lung fields. All sounds were resonant, which was a normal finding. So now I'm going to go ahead and auscultate in all of those same areas. Each time I move my stethoscope, I'll have you take a deep breath in and out, okay? Okay, go. Okay, very good. All lung fields were clear, no adventitious noises, which would be crackles, wheezes, or rhonchi. I'm now going to test for tactile fremitus. I'm going to place the sides of my hands down your back, and each time I move my hands, if you could say the words 99, okay? Go ahead.
99. 99. 99. 99. 99. 99.
Very good. Normal tactile fremitus, good strong vibrations starting at the top and diminishing as we go down. That completes our exam for the back. So you can go ahead and swing your legs back around this way. Okay, good. We're going to move on to the extremities. Looking at his arms, I can see that they're both symmetrical. Have you had any weakness in your arms?
Nope.
Any history of injury or
Nope.
surgery? Okay, good. So his skin color distribution is still normal for ethnicity. It matches the rest of his body. I do see normal hair growth is distributed equally. Let me take a look at your hands. His fingers are all intact. The nail beds look nice and pink. There's no splitting or brittleness. Cap refill is less than 3 seconds on that hand. Take a look at this one. Again, nails look clean and healthy. Nail beds are nice and pink. No brittleness or splitting. No signs of clubbing. And cap refill is less than 3 seconds on that hand as well. I'm going to go ahead and check for the brachial pulses. Brachial pulses were bilaterally equal, about a 2+, normal rate and rhythm. I'll do the radial pulses. Radial pulses were also equal bilaterally, normal rate and rhythm, 2+ grading. I'm going to have you squeeze my fingers as hard as you can, okay, and pull towards you and push against me. Okay, no weakness in arms noted, both pushed and pulled with the same amount of strength bilaterally. So, I'm going to check for edema over a bony prominence. No edema noted on either arm. I'm going to go ahead and move on to the legs. Any history of injury with your legs?
Nope.
No surgery or broken bones?
Nope.
Okay. Do you notice any weakness?
Nope.
Any numbness or tingling in your feet?
Nope.
Okay. Looking at the legs, they are equal bilaterally. They're symmetric. The skin color is distributed and appropriate. The hair is evenly distributed as well. There is no edema on palpation. The skin is warm and dry. I'm going to go ahead and do the popliteal pulses behind the knees. Okay, I'm going to test the posterior tibial. And the dorsalis pedis. Okay, all pulses were equal bilaterally, normal rate and rhythm, and about a 2+ grading. For this specific video, we are not testing the femoral vein, but if necessary, we would do that. I'm going to go ahead and take a look at your feet. Skin is all intact. Cap refill for the right foot is less than 3 seconds. Skin and toes are all intact here. I don't note any edema for either foot or ankle. I'm now going to have you push against my hand. Try to raise that leg. And this one, okay. Can you push my hands down? Okay. And point your toes up. Perfect. No weakness in either leg. They were symmetric with strength. down here. I think that completes my video. Thank you.